Thank you, Mr. Chairman, and to you and Ranking Member Crapo for putting together this bipartisan package. This legislation builds on our previous work on PBMs and will help ensure that patients have access to community pharmacies and lower prescription drug costs, and it will extend a number of expiring policies in Medicare and Medicaid. I'm pleased to see several bipartisan bills that I champion, including in the modified MARC, including policies that will improve access to telemental health care, ensure patient access to durable medical equipment, and remove barriers for states to offer individuals access to substance use disorder treatment. The SUPPORT Act, which Congress passed on a bipartisan basis in 2018, included an option for states to provide substance use disorder treatment in institutions for mental disease, or IMD. Unfortunately, this option expired on September 30th of this year. I introduced the SAVE IMD Options Act with Senators Hassan and Blackburn to make permanent a state plan option in Medicaid to provide patients access to substance use disorder treatment in IMD. Individuals across the country continue to struggle with opioid and substance use disorders, and inpatient treatment can be life-saving. South Dakota and Tennessee have leveraged this state option to provide this critical treatment, and more states are likely to opt into this option if it is made permanent. So Chairman Wyden and Ranking Member Crapo, Chairman Wyden and Ranking Member Crapo, will you commit to including this IMD policy in the next vehicle that addresses expiring health provisions and prevent individuals from losing access to substance use disorder care in states that currently offer these services?
I intend to work very closely with my colleague, and we have several colleagues interested in this. This is a very important issue. I was just going over with Senator Crapo. Got a long history with Families First, and I just want to thank my colleague for being willing to work with us. And both I and Senator Crapo want to work with the several members of this committee who are interested, and I'll yield to Senator Crapo.
I would just echo the chairman's remarks. We will work hard to get this done.
Okay. Thank you. I've also filed an amendment to this markup that would make long-term reforms of the Medicare physician fee schedule. The underlying bill that we are considering today includes a one-year payment update for physicians in Medicare. And in recent years, Congress has provided a payment update to physicians after CMS finalized across-the-board cuts. When CMS makes changes to coding policies, it often triggers cuts due to budget neutrality requirements. Unfortunately, CMS's assumptions used for some of these changes often depend on incorrect utilization data and may not account for the fluctuation in the cost of equipment or staffing. Instead of Congress making payment adjustments every year, it's time we address the underlying issues and make long-term reforms to the physician fee schedule to ensure there is stability for physicians and the Medicare program for the future. Reforms to the fee schedule should be coupled with updates to incentivize quality. And I'm happy to join my colleagues, Senators Whitehouse and Barrasso, today in an amendment to extend the incentives for alternative payment models, but Congress needs to also make long-term reforms to encourage a greater move toward value-based care. So, Chairman Wyden and Ranking Member Crapo, I ask a second question, that is, will you commit to work with me and my colleagues to pass long-term reforms to the physician fee schedule and incentivize value-based care?
Senator Thune, once again, is being way too logical for some of these kind of debates. You got to get at this long term. And I think, Senator Thune, you made the point that doctors are the backbone of the system. In other words, we can fuss all we want about various things, but you got to have doctors. And absolutely, we are going to work very closely with you. And as you know, this also connects with an area that we've worked on for a number of years in terms of chronic illness. And Chairman Hatch was terrific in terms of leading us to protecting the Medicare guarantee and doing it by addressing chronic illness. And you got to have doctors to do it. So absolutely work closely with you, and I yield to Senator Crapo.
Thank you.
Again, I agree with Senator Wyden's comments. The physician's fee schedule has been broken for years. We've got to quit limping along and lurching and stopping and starting again and getting it fixed. I completely agree with the need for a permanent solution. We'll work with you to get that done.
Thank you. Mr. Chairman, I look forward to continuing to work with you on these policies and seeing them enacted into law, and I thank you.